A hearty good afternoon and welcome to our session on dental care in children. It's a pleasure to have Dr. Susanta K Badatya among us today to help us understand this topic. Oral hygiene is very important in maintaining overall health in young children. So, the doctor will take us through the importance and a lot more in this process. Have this.
Thank you. Welcome all for this Facebook live session. Today's topic is dental care in children. What is the most common concern of the parents, which gets more concerning around 6 months of age. So we'll be discussing some salient points with the timeline of the dental eruptions and what the normal care we should be aware of, and some common myths associated with the dental hygiene and dental teething issues. So in this session, we'll be first discussing some technical aspects. Then, if we have some questions, we can take at the end of session. So, parents often think that these are the primary set of teeth, and they will be falling off anyway. Anyway, so why we would need to worry so much about it? So teeth are very important. There are two phases of teething in children. First is the primary, which is temporary. Then there is permanent teething. So the temporary teeth are destined to remain around 6 to 12 years. So first 6 to 12 years, they not only help in the chewing process and the eating process, they also give the shape to the face and the guide for the future permanent teeth in the right position. So they are crucial for the subsequent teeth to come. And similarly, they also help in the modulation of the voice. So they are very important for learning to speak, the language development, and jaw growth. Third common important function is for the aesthetics of the face. So for the baby's self-esteem, they are necessary to maintain the normal dentition in the children's. So what is the first we will be discussing what the normal timeline of the teeth eruptions and what is the routine care we should offer, which should be according to the age of the baby. So first 6 months of life, there is no teeth except the presence of natal teeth in some babies, like they are present since birth. So they are called natal teeth. First 6 months, the oral hygiene is not necessary by putting some cloths into to wipe up the milk stains or giving rinsing with water. So these things are not necessary if baby's oral condition, baby's there is no deposits as such in the cheeks or there is no oral thrush. Then routine cleaning or cleansing of the mouth cavity is not warranted. Just ensure the exclusive breastfeeding. If baby is developing some stains or some extra deposits, then you should get checked up with the physician and decide if the treatment is needed. From 6 months, around 6 months, the teething process starts. So baby will have some symptoms like drooling, itchiness, the mouthing process starts. So this period, there may be some issues associated with the teething. We'll be discussing further. So from 6 to 12 months, the first teeth erupts. So the timeline is set that from 6 to 14 months, anytime the teeth may erupt. So you need not to worry until 15 months. If the teeth does not appear by 15 months, then we will be investigating for the reason of not having teeth. So during this period, whatever teeth has erupted, that need to be taken care of first by brushing. Even if there is one teeth, then you should clean that teeth with help of brush. And use of toothpaste is optional. The toothpaste usage is not mandatory at this age. And as the baby starts walking and starts crawling, then you should take precautions not to fall by face, so that there may be injury of teeth and the face. Similarly, after 1 year, the number of teeth in the oral cavity increases. So it becomes must to brush daily, twice, 2 times daily. It's not practical to brush even after each feeding, but you should rinse the mouth after each solid food, so that there is no food residue left inside the mouth cavity. So first dental checkup is advised at first year of completion. So if, and at least after eruption of the first teeth, you should get the dental checkup commenced, and every 6 months thereafter dental checkup is advised. So the toothpaste issues is advisable 2 years thereafter. And at any age, you should rinse the mouth with water after each solid food intake, and the regular brush use is warranted. And you should avoid giving the sweetened beverages during or just before sleep, so that the sweet liquids which remain inside the mouth, they predispose to the formation of the acids, and the dental caries starts. So next most common questions parents ask: what type of toothpaste and what type of toothbrush we should use for the baby? So for initial 6 months, 6 to 12 months, you can use the silicone finger brush to just help the baby understand the practice of brush use. And thereafter, after 1 year, the appropriate size toothbrush should be used. That they should be soft bristled, and the shape should be small and oval shape, so that it accommodates in the baby's oral cavity. And the toothbrushes should be replaced with the earliest if there are wear and tear happens, or at every 3 to 4 months as the bristles starts to wear and tear. So next important is that what type of toothpaste you should use. So low fluoride toothpaste are recommended. Fluoride free toothpaste are not no more recommended. There should be low fluoride toothpaste usage during the childhood, and it's a safe mineral. So there is no harm even if baby swallows some bit of toothpaste. So we should know that if we have bad oral hygiene or bad practices, then even if it is the milk teeth, tooth decay starts early, because the milk teeth or that temporary teeth are have very low enamel content, so they are very much prone to erosion and tooth decay. So if baby there is intake of formula milk, juices or shakes or ice creams, and the mouth is not cleaned regularly, then there will be tooth decay, as there is formation of the acid by the bacteria inside the mouth, and they deposit on the enamel. They start corroding it, and there becomes a hole in the or cavitation in the teeth. So how to identify early signs? Maybe the presence of discoloration like white spots upon the teeth. Then that formation of early cavity that gives the appearance of light brown colored plaques on the teeth. Then that becomes darker, and there becomes cavitation. And meanwhile, on not only there is discoloration of the teeth, that becomes sensitivity. So during intake of any cold or hot beverages, baby may express irritability and inability to chew open, or there will be change in the behavior due to the pain or sensitivity in the teeth, which baby may not express outright. So how to prevent the dental cavities? First foremost, we should have a healthy dietary pattern, so that during sleep or just prior to sleep, even if baby takes milk, you should rinse with the normal water, so that there is no residue remaining inside the baby's mouth. Even if we are giving some teether, you should not dip into the sweeteners, so that the prolonged presence of sweetening agents inside the mouth cavity, that leads to the formation of the acidic content by the bacteria fermentation. So next questions parents ask, if we are having thumb sucking, does that leads to the malalignment of the dental setup? So it's very normal for the babies to start sucking their thumbs fingers. That may start as early as 3 months. That is called normal mouthing. That gives a emotional security and comfort to the baby. So you should not try or should not be worried about that part. But that habit gradually wins off subsequently 1 to 2 years as baby gets involved in other things. But due to some emotional stress or things, they may continue it beyond 4 5 years. If they are this habit are persisting by 4 5 years, when the permanent set of teeth are coming, then there may be some dental issues, like there is a malaligned, and there will be misalignment of the dental tissues, so that they need some braces or some interventions according to the severity. So next, we will be discussing some teething associated myths. First, parents often starts worrying that around 3 months of age, when baby starts putting everything in mouth, they're worried that teething has started. But you should know that teething has the phases of teething. There are 5 phases. First due to 6 months, where already every baby is having all the 20 teeth inside the gum tissue. So they're not erupted, just they're present in the jawline. So whenever they around 5 to 6 months, the eruption phase starts. So just prior to that, irrespective of even if that teeth eruptions comes at 9 months, 12 months, or 14 months, the baby is trying to put everything in mouth. That is called mouthing. That is not related to teething. So irrespective of teething eruption, baby may chew their own hand. Thumb sucking is normal for 3 months onwards in infants. So whenever the baby starts erupting the teeth, the gums become sore, so they become inflamed, and the initial phase baby may react as change in mood, change in the there is a presence of irritability, there is excessive drooling, and there may be crankiness, unusual crankiness. There will be presence during the daytime or nighttime. So if we notice there is some swollen or sore gums, then we suspect that teething has started, and we should just give the supportive treatment. There is no specific treatment for teething as such, but some home remedies, like first just give some gum massage. You just gently massage the gum, so that the sore gums are soothed. So to soothe, you can offer the teethers, but the teethers need to be cleaned, and hygiene maintenance is another additional responsibility. Third, you can offer some uh, refrigerated clothing. So the cloth, washed cloth, you just keep into the refrigerator. That becomes bit hard. Then that can be chewed upon, so that baby derives some soothing effect from that. Or uh, the large chunks of any fruit that is hard enough to chew upon, that may be another option. Third thing, there's some over-the-counter painkillers you can use, so that if the baby is very much cranky enough, then you can use the this over-the-counter pain relievers after consulting the doctor for a specific dosage. There are some teething gels available in the market, but we discourage the uses of teething gels because the anesthetic component in the gel, if we are using multiple times, that may be ingested to the baby and may cause complications to the baby. So the teething gels are not discouraged to use in the babies. Um, People and the grandmothers are very fond of using some homeopathic medications during teething, but these are the medications to be used under the guidance of a homeopathic doctor only. There is no such teething supplements type of medications to be used as a regular practice, as not encouraged at all. But if you are interested to use some medications, case to case basis, that should be judged by the medical practitioner only, like homeopathic doctor. So they can be used. So as a our specialization or our branch of medicine, we don't advise such medications to be used without any consultation of the doctor. Third thing, the parents often attribute teething to everything. Like the baby is sick with fever, there's a loss of appetite, or there is diarrhea. So we need to understand that teething has no role to cause any disease or sickness in the baby in form of fever or diarrhea or cough cold, or there is any breathing difficulty. So uh, there may be some bodily changes related to the sore gums, like there may be mild elevation in temperature, not amount to fever, but baby may feel warm. There may be irritability, maybe drooling, there will be change in mood, there will be pain, excessive crankiness. That are possible, but there are no scientific evidence that teething may cause this fever and cough, diarrhea like thing. So if baby is sick with fever, then alternative reasons of fever or these symptoms should be sought, and accordingly treatment should be done. So this brings to the end of our session, where we have learned that teething is not the root cause of every illness in the baby. There is stage-wise teeth eruptions in the baby, and first eruption may take 6 to 14 months in a baby. So beyond 14-15 months, if baby is not having teeth, then we should investigate the reason of our baby, whether baby is having calcium deficiency or vitamin D deficiency or in thyroid insufficiency. So that will be our giving our answer for not having teeth. And according to the teething manufacturers, what home remedies we can do, and if the baby is having excessive symptoms, then we should sort the alternative reasons for the illness. And according to the age of baby, what type of food care we can take, we have discussed, and what type of toothbrush and toothpaste you should use, and that frequency of dental visit we have discussed. So if we have any questions, we can take that. Okay, as of now, there is no questions. If there is no questions, we can stop this session. Thank you.